Well, it is noon, so I'm feeling like, Dawn, if it sounds okay to you, I'll get started with our introduction.
Yeah, that's fine.
So thank you. I know we're going to continue to have people joining in, but we're going to go ahead and get started. And first, thank you so much for joining us on this presentation we're really looking forward to from Dr. Don Bilau. It's called Filling the Gaps, Promoting a Youth-Focused Mental Health Literate Community. We are taking attendance for certificate and CEU purposes. Please enter your name, organization, and email address in the chat box, please. And Sarah is entering it as a written note in the chat box, what I'm saying right now. Please indicate if you're an LMHP or LIMHP, and that if you'll be requesting CE for this event. Watch for an email after the workshop for slide notes, the attestation form for those who are applying for CE, and also an evaluation. We'd sure welcome your evaluation. One CEU is offered for LMHPs. And again, those who want CEUs or need to attend the full webinar and complete the appropriate documentation. So on to why we're here, why we're gathered here. We're hosting this workshop and many others, and we're glad to see some of you have been with us before. Hello, Emma Johnson, glad you're joining us too. This work a result of the state maternal and child health assessment that found there needed to be an intentional mental health focus on our youth, especially 10 to 19-year-olds, and preventing their death by suicide. Locally, we're working with many partners to have a more comprehensive approach to addressing youth mental health needs. So we're grateful for the Title V MCH block grant funds that enable us to provide this education today. We are also grateful to Dr. Don Bilau for his consultative support in this project and for all the experience he brings in equipping us for helping youth to thrive. So let me introduce you to Dr. Bilau. He serves as a school psychologist and has extensive experience in working with children and adolescents. We are so pleased he can share this content with you today. Thank you, Don.
You're welcome, Chris. Thank you for this opportunity to engage a conversation about promoting a youth-focused mental health literate community. And quite frankly, our youth, which we could probably say are virtually any age, but particularly ages 10 to 19 or 20 or so, they're oftentimes left out of the effort to promote a mental health literacy within a community setting. So today, hopefully we can talk about filling the gaps and also kind of lean into preparation for the November workshop that we'll be talking about here in a bit. One of the ideas I'd like to promote to you is the idea that we're all learning. We're all learning from our youth. We're all learning from social media ourselves about how social media in particular influence mental health literacy. Uh, I'd like to have you, if you could, enter in the chat box your email addresses as well. And Sarah, if you'd be so kind to enter my email address as well. Well, one of the things I have a challenge in doing is talking and typing at the same time. It just doesn't work for me. So Sarah, if you'd want to do that, and the rest of you, if you'd want to do that as well, helps us to connect with that. That way, if you have any comments or questions later on, you can certainly reach out to me by email as well. So let's take a look at this lunch hour webinar, lunch and learn kind of a process as we move forward. Here you can see a little bit more information about what we're attempting to do. And Chris has already mentioned some of the support that folks have provided for this effort. You know, the Four Corners Public Health Department is a sets a gold standard in my opinion in terms of promoting mental health literacy, promoting the idea that our youth are able to learn, and that we as adults within the community should set the standards of care as well for our youth. Here's that save a date kind of idea. We're looking ahead to November 6th, which is just around the corner. There's a workshop entitled Pathways to Better Youth Mental Health, Reshaping the Landscape Together. What a wonderful title. It's an exciting title, and as we're seeing the Four Corners work together in promoting this, I encourage you to please save the date and get more information as to how you can access that participation for that particular effort. And so today there are four primary objectives that I hope that we can cover in one shape or form. And please put any comments and or questions in the chat box. Sarah will be assisting in terms of monitoring that and can provide the opportunity for us to respond to that effort. So if we look at objective number one, you see what we want to do is talk about the importance of a mental health literate community and its ability to promote positive mental health for our kids and families. And our second objective is going to be talking about at least trying to describe two techniques that can promote health-seeking skills that can be shared with our youth. And also, I want to talk a little bit today about the cyberbullying experience that many of our youth tend to be exposed to at a quite young age, late elementary, certainly through middle school, and how that impacts mental health. And I see this as being part of mental health literacy, is being aware of what that may look like and the different experiences that youth may have within that cyberbullying sort of experience. Our third objective is we want to talk about at least two strength-based community resources that within the Four Corners area that can contribute to promoting positive mental health. And certainly this objective is something that I'd like to have you as participants kind of be thinking about. And as ideas kind of pop in your mind about resources in York or in Seward or Butler County or wherever, that you kind of pop your ideas in terms of the resources that do promote positive mental health literacy for youth. For extension, for example, the extension group, they do a lot of great work through 4-H that allows for youth to learn positive skills. So certainly that would be one example for you to be thinking about. And our last objective is to look at actions. What kind of actions can promote the mental health literacy of youth within the Four Corners area and within the communities within that area? So that's what we hope to accomplish today as we move forward. So what is a youth mental health literate community? Quite frankly, the evidence and the research presents a sort of a mixed review of what that might be. But I think I would want to share some ideas that I had that may contribute to understanding what that might look like. I think it begins with recognizing the foundations of good mental health, knowledge of activities and habits that contribute to mental wellness, and such as regular physical activity, healthy eating, adequate sleep, stress management, and socializing. You might say, gee, that's probably good advice for us adults as well. And it is. It is. But that's what the beginning of positive youth mental health literacy begins. Now, one of the keys that you might recognize, you might say, adequate sleep. How does it, what's Dr. Belon mean by that? Well, in my work as a school psychologist and working with youth between 10 and 19 who might present some level of crisis that I work with in terms of providing interventions, I always explore the idea, how are you sleeping? You know, and constantly I receive information from these youth and children about, it's hard for me to sleep at night. Well, then I probe a little bit more into that, and I find that their phones are sitting by their bedside. I find that they're waking up at 2 or 3 o'clock in the morning and checking their phones because other youth are checking their phones and they're texting each other. Many parents find that hard to believe, But when I share that information and they start checking, I go, oh, gee, what are you doing? At that time of the morning. So the influence of social media and extends into this area that can disrupt that positive, healthy habits that they could be experiencing. And certainly stigmas. We've done Four Corners has done a lot of work in the last couple of years looking at stigmas that are associated oftentimes with mental health issues. And certainly this is an action plan, a process that is an ongoing process that can help promote youth mental health literacy by identifying stigmas that youth are experiencing. And there's a whole multiple of different influences and we'll touch on some of those. And part of good, positive mental health literacy for youth means being able to seek support and having knowledge of different types of help and how to ask for help. Now, one of the positives that do come out of social media is that youth can connect with each other and encourage each other to seek help. I personally can attest to that. And then recently, I had a couple of youth who were influenced by peers who encouraged them to seek out Dr. B. He can help you. These youth went to their counselors, they went to teachers, and they asked to see Dr. B. So, and how did they come about that? The influence of their peers through some level of social media contact that they experience. So there are some positives. I want to remind folks that social media can promote some positive mental health literacy, but by the same token, we need to be aware of some of the adverse impacts, which we'll go into some detail. This last bullet talks about time-sensitive pathways to access those resources. And I think families struggle with that. They identify that their youth is struggling with a mental health crisis or a mental health issue of some sort, some level, and they struggle with finding a rapid response, if you will, to seek help. Unfortunately, just yesterday, I was working with a youth in crisis, and a family member said to me that they tried to get help, but they were told repeatedly that there were 45, 60-day waiting lists before they could access help. And certainly the other flip side of that is for some families, it's difficult to find a process to pay for that. So we're going to talk about a little bit more later on about some ideas to help families and youth navigate, if you will, a process of seeking help and getting help. That's all part of empowering youth mental health literacy. And what we do recognize through evidence and research is that youth with greater mental health literacy are more likely to be resilient, particularly in times of stress. And if you remember, adolescents and near adolescent kids do experience a lot of drama, experience a lot of stress that could unfold into possibly mental health issues. And if they've been taught good mental health literacy, the likelihood of them being able to provide positive psychological resiliency is enhanced greatly. What's interesting is that the evidence suggests that many youth, particularly those from lower socioeconomic groups, that with mental health literacy, they're more likely to seek help. So the efforts that schools do within their school settings that promote help, sources of help, and promote positive mental health literacy does pay off without question. Empowering youth to connect with each other and trusted adults promotes youth mental health literacy, but certainly slows stigma. It impedes stigma, and it promotes well-being in general. And the key is trusted adults, is helping them identify trusted adults. And that doesn't necessarily mean that's going to be mom and dad, because mom and dad, they may not trust for whatever reason. They might find a coach at school or a faith community member that they can connect with, or it could be the neighbor down the street who may be non-judgmental and supportive. So certainly trusted adults is part of positive mental health literacy for youth. And developing social media literacy skills, if you will, for youth, which is I define as being the ability to take personal responsibility for social media use, and to be, which calls for being informed about the dangers of social media as well as how it helps. So I'm hoping that schools will continue to take up the challenge, particularly the area of promoting positive social media literacy, which has direct influence upon mental health literacy. I see the two being engaged with each other, entwined with each other, if you will, more so in this point in time in our culture than perhaps any other time. So when we look at social media influence, and we'll talk about that a bit, it could include social networking sites, Instagram, Snapchat, Facebook, TikTok in particular, texting, if you will, social gaming tools, YouTube, and more. You may say social gaming tools. What does that mean? How can that influence the youth in general? Social gaming. Well, it turns out there's a number of games that create chat rooms that easily connects with users who may have similar interests, but those interests, unfortunately, can be extremely counterproductive or unhealthy. This is what law enforcement calls the dark side of social media, if you will. And Discord is an example of a gaming chat room where it has been found by law enforcement, a variety of individuals getting involved in these chat rooms, and they encourage unhealthy behaviors. They encourage negative behaviors, aggressive behaviors. So, and so Discord, you might check it out sometime, and you'll find that on face appearances, it looks like a relatively harmless sort of a experience, but that's not necessarily what has become. I personally been involved in doing a number of threat assessments where I have noticed that individuals who have been engaged in this type of behavior, Discord is used daily to connect with others who encourage this type of behavior. Something for us to be aware of. And other gaming chat rooms are designed where a comment comes in place and then it disappears. As soon as a user opens that particular comment or responds, it disappears. So certainly, when we talked about the dark side of social media, this is one example. And as we noticed before, social media can certainly expose children and youth to content that produce risk of harm. Evidence supports that, and we'll see a little bit of that in just a few minutes. What we are aware of is that social media in general can certainly reinforce the disordered eating behaviors, social comparison, and particularly low self-esteem among adolescent girls. That's what the evidence suggests. One of the things we need to remember that youth are massive consumers of information and misinformation that appears on platforms such as TikTok. And the misinformation is dramatic. And we'll show you an example of that. And if any of you have any other examples of misinformation that the youth that you worked with that have been influenced by the information, you might put a couple comments in the chat box about that particular experience. So we'll look at that a little bit closer in just a couple of minutes. One of the interesting pieces that in the last 3 to 4 years and continues is AI. AI, artificial intelligence, has really emerged as an easy, powerful contributor to misinformation that is posted online that our kids consume. It's important, I think, for us to teach our youth from a parent perspective, as well as a teacher perspective or a counselor's perspective, to pause, focus, be mindful, when you're engaging in social media use. It helps temper those feelings that might be bubbling around as you consume. Remember, our adolescents are kind of like like microwaves. They get hot and cold really quick, and then us adults, we just kind of sit there and simmer for a while. And our kids, they see something and go, "Oh yeah, that's me." They identify with that, and it's just a half a step to moving into from identification to some sort of action. The notion of kids reinforcing bullying and cyberbullying is part of that process that occurs is seems to me connected with that influence that can be done to that youth can experience. And so certainly when you're exposed to an idea or a behavior and it captures reinforcement, then that suggestion can become action that is harmful and unhealthy in a matter of moments. When I've worked with dealing with kids who've been involved in crisis, who have been targeted for bullying, I find that the recipient of those behaviors often had no idea that they were a target until it was too late. And working with those who engage in that type of behavior, I find that they report that it seemed like a good idea. Everybody was doing it, was tended to reinforce that's okay. It's okay to engage in that type of behavior. More than half of the kids in one particular research center earlier here in 2024 said they've used social media to diagnose their own mental health conditions. Now, isn't that interesting? So, it's interesting in the sense that kids want to know what's wrong with me. Why am I feeling this way? Why are other people looking at me? So they go to Dr. Google or they go to some other search engine, and they're looking for answers. Why is this happening? And so so it's interesting to see that young people are using this to diagnose their own mental health conditions. Oh, by the way, if you see something that sounds good, that seems to fit, well, then that must be me. So then I will begin acting that way. It's a self-fulfilling prophecy I have found through the years of youth who are experience this particular influence. So we kind of talked a little bit about adverse effects. We're going to talk about that in a little more detail. And remember, the youth mental health literacy and is entwined closely with social media. And so we're going to talk about some of those adverse effects. It wasn't too long ago, I think it was in 2022, the U.S. Surgeon General issued an advisory. And here's kind of the highlights from the executive summary of looking at the research that was available at that time. So 46% of those youth aged 13 to 17 said that social media can make them feel worse. Well, I'm sorry, 40% said it makes them feel neither better or worse. And others, if you see the slide, 14% said it made them feel better. So, when it's 46%, there we go, said the social media made them feel worse. 40% neither better or worse, and 14 said it made them feel better. Now, isn't that interesting? That particularly talking about the influence upon their body image. Nearly 2/3 reported that they're exposed to hate-based content. Remember what I said a few moments ago. It doesn't take much to separate the thought to the action. And certainly hateful, harmful actions may be connected with that influence. And that last bullet on this page talks about some social media platforms show suicide and self-harm content, including live depictions of self-harm. As a member of Nebraska Child Death Review Team over the last 10 to 15 years, unfortunately, I have seen episodes where there has been links between this type of depiction of suicide and suicides in the state of Nebraska. This is very real to me because I've seen this firsthand, that influence. And from a perspective of working with kids in crisis, they excuse me, they also can easily tell me what websites they have visited and what types of information that they have done in terms of planning and research. So it's important for us as therapists, by the way, to routinely ask, and through our assessments of our youth, to in terms of what type of websites do they visit, what are the interests that they have, to further explore the possibility of developing safety plans or enhancing safety plans for those youth in terms of preserving their lives. Other influences can certainly include that drama that youth do experience, promoting drama between each other, and so that risky content. That's where teaching kids what responsible social media use looks like and what to do when they experience a sense of a threat or emotional distress, to reach out for help. Uh, so when we look at these sort of adverse effects, certainly we need to be aware of that vulnerability of our youth that we work with. And I want to emphasize vulnerability. There's two words that seem to be echoing within us as school counselors, school psychologists, and therapists that we need to focus on when we're working with youth in general. And one is vulnerability. What's the vulnerability of our youth? The other is resilience. We've used both words so far. And I think those two words really capture the idea that of enhancing our awareness of where our youth are at in terms of enhancing their mental health literacy, and because that's promoting resiliency, and it's also decreasing, hopefully, vulnerability to adverse impacts. Other effects can include the ideas that the comparisons they oftentimes use. So will try to compare themselves with others in whatever areas. And if they see themselves not measuring up, if you will, in their minds, and that can certainly reinforce a negative sense of self-esteem. Notice that last bullet, I talked about this a little while ago about sleep issues. 40% of adolescents report that they use a mobile device, their phone, within 5 minutes before going to sleep, and 36% report checking their device at least once during the night. Pretty interesting to that the youth are reporting that. So clearly the impact of social media sleep quality can pose a risk, in my opinion, of mental health concerns among youth. Particularly when we start thinking about emotional responses to daily experiences that youth might experience in a public school setting. They may be irritable, or they may be more withdrawn, or they may not be able to concentrate because they're nodding off, if you will. Certainly within some educational settings, teachers find themselves struggling to help sustain attention for our youth. And I think we should explore with parents that when we see that sort of experience, that sort of behavior, what is that possible impact of their access to their phones, if you will. So I want to talk to you about an example of a misinformation that, and there are hundreds of examples, but this is one that really kind of struck home to me. Here's a message: people with ADHD don't miss their friends when they're not around. Interesting message. So let's think about that a little bit. People with ADHD don't miss their friends when they aren't around. Okay. So there's a video where a man is talking straight in the camera about ADHD. He claims that those who have this disorder don't miss their friends when they're not aren't around because they forget them. So don't worry about it. It's not a big issue, right? From that perspective. He says people with ADHD have the ability, excuse me, we do not miss anyone. And it's an object permanence in a sense of time permanence that we're almost, in a sense, blind to this. It's how our brain functions. They're not texting us. We forget them. Turns out this person who put this message out on TikTok, by the way, he has more than 1 million followers. He has messages that reinforce the concept of um, don't listen to your teachers. They're not helpful. Don't listen to your parents. Do what you want to do no matter what, because what's important is what you want to do. This person has 1 million followers. And a link to that website from TikTok shows him as being a mental health advocate, but doesn't list any credentials. So you kind of get a feel now that our kids who are consuming information may walk into something that's colorful, attractive, appeals to them, and so they might start integrating those messages into how they think and they process information. So some of the barriers to building a youth mental health literate community, by the way, and you just saw one of those, is the influence of stigma. And certainly when we think about stigma, we start thinking about how those attitudes could create embarrassment and a fear of identifying mental health illness. If you look at bottom bullet, it's prominent among many young people about what others are thinking about them if they seek help. That's a pretty powerful stigma, by the way, because asking for help implies that you're weak, particularly for males, and it can also imply that don't trust anyone. So the other piece is that I think it's useful to acknowledge in terms of help-seeking skills barriers that kids may experience is that some kids just don't know how to identify their difficulties. They find it difficult to find the words. So one of the pieces of research I looked at recently is that, which I think is kind of fascinating, and I would agree with this, is that when kids are aware of distress, they constantly alter their definition about, if you look at bottom bullet, about what was normal distress to avoid seeking help. So their changes, their identifications, their definition of being in pain changes. As you can see, seeking help from someone else is often found as an indicator of weakness. Other barriers include a lack of trust with people, the adults in their lives. As I mentioned before, being unable to find the right words to express their feelings. And in fact, one of the keys to building positive mental health literacy among kids is to early on begin teaching emotional language as being part of your mental health literacy. And certainly University of Nebraska and Lincoln has done a lot of research that has looked at emotional language and the positive outcomes to teaching youth, whether at all ages, what emotional language may look like. We don't have the time today really to talk about that, but I just want to mention to you the importance of reinforcing language skills as connecting shades of emotions with words, and what we can do from a mental health therapy point of view and schools, counselor, et cetera, point of view as well. Also, it's kind of interesting that some of the research says that if young people are giving a lot of information about mental health, it may have an adverse impact upon health-seeking behaviors. And part of it is because a self-fulfilling prophecy that I mentioned. On the other hand, same research says if youth can be reassured that seeking help will lead to a decrease of pain, an increase of hope, these behaviors tend to increase. So that's our job, reinforce help-seeking behaviors. So I wanted to take, again, a look at cyberbullying. We've kind of referred to that, and it's certainly a threat to youth mental health and mental health literacy in general. So does cyberbullying still exist? It does. It's real. But to some extent, it's gone undercover. But nearly half of the kids have reported experienced at least one of these 6 cyberbullying behaviors. And those include offensive name calling, spreading false rumors about them. Oh, that's a middle school thing. I can vouch for that. The drama, if you will, is based upon false rumors that middle school kids often feed into. Receiving explicit images, the sexting, if you will, physical threats, constantly being asked where they are, who they're with, having explicit images of them shared without their consent. Those are the type of behaviors that often. This chart kind of takes another look at that again. Pretty interesting. Again, think about all the kids who have experienced cyberbullying, and perhaps your children and grandchildren have, but they've not, they don't share that they have experienced that. Perhaps they become desensitized. So it behooves us as therapists, as school counselors, and as parents to ask our kids, have you experienced these type of behaviors? Because that gives us the opportunity to promote resiliency with our kids we're working with. This graph also talks a little bit about older teen girls. Excuse me, breaks out the data a little bit more. Pretty interesting slide. And this particular slide takes a look at the roles of cyberbullying. It's like a puzzle, if you will. It's like a 50-piece puzzle when we start looking at youth experiencing cyberbullying. And I think what I found through years, and particularly in the last few years, when I notice that a kid responds positively to experiencing some of those behaviors that we talked about just a moment ago, I start looking into the puzzle. What are the influences that has led to that kid experiencing cyberbullying, and those who are the aggressor? What are the influence? So you have the aggressor, you have the bystanders. There's a lot of kids know there's something going on, but they're afraid of reporting. They don't want to look different. They don't want to talk to an adult. Then there's kids who are what we call upstanders. These are kids who are trying to break the cycle because they've been reinforced by schools. They've been reinforced by parents that it's important to be responsible and report this type of bullying behavior. So we have bystanders and upstanders and the aggressor. Now, it turns out that kids can play different roles at different times. So they don't necessarily get locked in. The aggressor could be the upstander. He could become the bystander because kids are constantly responding to influence within by their peers and within the dynamics of whatever setting they're in. So I think it's important for us as school counselors, as therapists, as parents, to kind of listen and try to identify the role, because then that helps us to identify a response, if you will. The key is for us is that it allows us to promote youth mental health literacy by letting kids know that a safe world is everyone's responsibility. Like reporting a bully, cruel online comments, let someone know. That's important for us as adults to promote. So we start looking at, again, reinforcing youth mental health literacy, it's important to reinforce help-seeking skills. Now, we already talked about barriers a little bit ago. So what do we do now? If we know what those barriers are. Well, what the research says is that help-seeking interventions that focus on mental health literacy allows for the opportunity to develop help-seeking behaviors, and it reduces stigma. What we're learning is the power of social media to help kids learn skills to reach out, and it reinforces their help-seeking behaviors. Just in the example I shared with you a bit ago regarding myself. I think it's important for us to, when we work with kids who experience and report cyberbullying, or we notice it from an upstander or bystander perspective, something that comes to our attention, we want to encourage our kids to resist the urge to retaliate or respond. You can imagine what that does to that whole cycle. We want to say to our kids, if you're angry or hurt, you might say things you'll regret later. Cyberbullies want to get a reaction out of you. Block the bully. How about that? That's a simple way to block that texting. Block it. If you get mean messages through a social working site, take that person off your buddy or friends list and delete the messages from those identified without reading them. That's hard. That's hard for youth to do that. That's where I have seen school counselors who have, when they become aware of this situation, will work with the youth and encourage the youth to share that information with them, and they will together, they block that person. Particularly in our high school age kids, where that their phones are oftentimes, depending on the school building, are at their fingertips or not far away from them in some way, that you have the opportunity to become supportive and model that behavior. Print out bullying messages. That can be very helpful for us as adults. Talk to a friend, again, positive peer influence, and tell a trusted adult. And again, that's not easy, because for a lot of reasons, youth don't necessarily see adults as being trusting. They see us being judgmental, and they maybe just don't want to get in trouble from their perspective. So building relationships that are safe is part of building a resiliency and decreasing vulnerability. What about parents with that cyberbullying experience? Here's some tips that's evidence supports. If parents identify the kids have been bullied, go to that company's website and try to find some information about how to block that. It may give you recommendations or change the setting, or who can contact you. Call your cell provider. And then some carriers do offer anti-bullying features for a fee. Verizon, I believe they have that resource that's available. You certainly just have to connect with them as a parent, when you're concerned. So what about the positives? There are certainly positives. And when we look at some of the evidence that's out there that supports that idea, 80% say it lets them feel connected to their friends. Now remember, connecting for peers is critical. It's very important because it gives them a sense of identity. 77% of kids reported social media was at least somewhat important to keep up with her friends. About 70% said least important. So you can see as part of their daily routine. In adolescence, they talk about connection as being a primary positive aspect of social media. And again, social media and mental health literacy can be intertwined, if you will. What we are acknowledging through evidence and research I have reviewed is that it can provide us a protective role for our kids. And one study, and I will vouch for this, is that over half of kids were hospitalized, reported receiving support or encouragement during 2 weeks prior to admission. And I would vouch for that, when I have interviewed kids about their experiences and how their battle with the crisis that they were experiencing, there have been positive influences. Unfortunately, there's a lot of other negative influences, but there is a gateway for that opportunity. So when we think about strengthening at mental health literacy, what's important I think, is to hear stories from adults who talk about their struggles as a youth. Having access to um, literature or books or whatever where they can identify with helps them identify that there is hope, because their issues become less scary, more real, and relatable. Roughly 3 to 4 kids seeking information about depression said that they were also looking for personal antidotes. And that's encouraging. They're looking for help, but they're also looking for ways that others have been able to survive that experience. I think it's natural for us as human beings, whether you're 73 or you're 13, is to want to identify with someone who has struggled with your same issues you have, and they found a way to move forward. That gives us hope. And when the kids hear those stories, hear those experiences, those narratives, it helps ground them. I think identifying safe apps with youth can help them identify coping skills with that mental health questions they may be having. Promoting 988, I think, is important. Promoting trusted relationships with adults and parents in a non-judgmental manner. That's what I think is critical. Here's a few examples of safe apps as we move forward the next 10 to 12 minutes. I'm sure there's a lot of apps out there, but kids, I encourage them to use apps to help them. Virtual Hope Box is one that is useful. It takes a little adult guidance to use this, particularly for high school kids, but it can be, once you identify or walk through that app with particular high school kids, it seems to be useful for them. And My Companion is an app that was launched in Nebraska State Suicide Prevention Coalition in 2022. That is very useful, and it's got a lot of positive responses from kids who have used that particular app that's helped them cope with. So My Companion, MC is what it's called. You can certainly help guide young people to access that. So what can we do? What can we do? Kind of leading into our November workshop, if you will, as we lean into that. What can we do? I think it's important for us to encourage the primary or community resources available to connect with each other. School, the faith, 4-H, extension agencies, health, public health. You can see we're all interconnected, and we can draw more and more lines. If we come together and say, this is a goal for us to enhance youth mental health literacy, it's a very realistic goal to save lives by taking those steps. And I suggest that there are community action steps that don't take any money, just takes encouragement. For example, I'm aware of faith communities within larger communities who are on a pathway of encouraging families to put the phone down and talk to each other during supper. What a novel idea. Put the phone down and talk to each other. Become unwired. In fact, is within some faith communities, that is the notion. Let's encourage our families and kids to become unwired. That certainly promotes youth mental health literacy. Encouraging community health providers and schools as early as late elementary, promote mental health literacy, responsible use of social media is positive. Becoming aware of resources within the national level and local level that can stamp out stigma promotes youth mental health literacy. Stamp out stigma is a movement across the country. I encourage you to just Google stamp out stigma, and you'll find a whole lot of wonderful resources that are available at your fingertips that can be applied in whatever area you're at. Faith community, school, business community, wherever you're at, there are some wonderful, clear action plans. So when we talk about steps, we're talking about promoting an awareness that there are challenges, but we can reduce any shame surrounding them by encouraging youth not to see themselves as burdens, but to encourage them to unstack that resistance and to seek help, if you will. Media campaigns are certainly one key area or action response that communities can take. We look at what the research says is effective. Research says, let's encourage adults to talk about substance use disorders and mental health illness in a way that reduces stigma. Unfortunately, we tend to talk about these sort of issues that reinforce the stigma. And of course, our kids are listening constantly to what we say and how we act. It's important to use this process, and I think you've probably heard this in other workshops about safe messaging. Use first language. A person with a substance use disorder instead of an addict. You know, avoid using that derogatory, stigmatizing language, if you will. Awareness campaigns, systematic change by doing whatever we can do to reduce barriers to substance use disorders and mental health treatment by identifying, enhancing speedy access to community-based resources. What a novel idea. I got all kinds of novel ideas today. Speedy access to community-based resources. This idea of having to wait 30, 60 plus days for mental health treatment for a youth, that is frightening. It's discouraging for parents and kids to access consistent support. We have to do something to reduce that. And I think you'll find that something could be easier than we think. Develop a 3, 5, or even 7-year plan. You might say 7 years. Oh my gosh, what are you talking about? Continuity and sustainability promotes mental health literacy for our kids. Embrace the kids in planning the implementation of youth mental health literacy actions is critical. Get their voice. Listen to their voice. How often are they accessing Discord? What can we do to promote social media awareness? Develop innovative programs such as parent coaches that can help and guide parents navigate with their youth the pathways of healing. Now, these could be peer-trained adults or mental health therapists who are wanting to assist parents and youth as they seek immediate help and support. Because if it takes 30 days or 60 days to get continuous mental health therapy, what are we going to do in between time? Well, perhaps that coach can work and figure out a way to help get us through to the next level. Development of these pools of coaches could be a resource that can have a powerful impact. This is a thought that I've had, I've shared with other folks in other settings, and frankly, it's not a novel idea. I wish it was, but it's not a novel idea. It's an idea that the adults experience, not necessarily youth. So I think the Four Corners area, the state of Nebraska, hopefully could take a look at this concept and say, well, that's a good idea. Let's figure out how we can make that work. Community action steps, zero suicide efforts, knowing about resources such as the National Alliance for Suicide Prevention offer a wealth of information. So as we kind of pull this together next 4 to 5 minutes. What innovative actions can be identified in the Four Corners District to enhance youth mental health literacy? I leave you with that question because that's a springboard into our November workshop. What can we do in 4 districts to enhance youth mental health literacy? So this is a little reminder about the November workshop. I'm going to pause for just a second here and see, Sarah, are there some questions that you've noted that you might want to share or comment? So I'll try to take a look at the chat box as well.
So far, I haven't seen any questions, but this would be a great time to ask them. Feel free to put them in the chat box, or at this point, you could even unmute and just talk to Dr. Bila yourself.
Or you can simply email that to me. So
So Dawn, just to build a little bit on your parent coaches, there are peer support, but are you thinking parent coaches would be a little bit different or specialized in a different way?
Yes, I am, Chris. What I'm what I am thinking, and based upon interactions with parents and kids over the last 18 months or so, that that when they do get to the emergency room or they get to go into some sort of a triage process, they need someone to help guide them at that moment in time. So it would be sort of an on-call kind of a person, I would suspect, that could come in and be able to kind of a launching pad to help that the youth and those parents to get some idea where do we go from here. And certainly it doesn't necessarily mean that youth would necessarily be a high level of crisis, or they might be in an emergency room. It could be some other kind of setting, but at least that service could be offered to help that family to get grounded in terms of where do we go from here. It's again, it's not a novel idea, but it's something that I think when parents are confronted with a youth who's experiencing a mental health crisis, so it'd be self-interest behavior, suicidal behavior, aggressive behaviors of some sort, substance abuse issues. Oftentimes they're emotionally laden. They may feel embarrassed, they may feel angry, they may feel all kinds of feelings, and they're not necessarily able to focus on the issue at hand. And so if we had someone who perhaps a peer navigator who has a different level of training and come in and be supportive to help that parent and you figure out where do we go from here. For example, if a youth presents some type of act of self-interest behavior, what kinds of concerns can we express to that parent that they need to notice, and that navigator can help talk about safety and immediate steps to take to create a more safe environment. And so there's a variety of different processes. So mental health therapy is certainly a step to help the youth and family to help find some way to resolve some of those issues. But we need somebody to come in and help support that person and that family at that moment of discomfort, if you will.
Yeah. Thank you for going into a little more detail on that for our listeners.
So that's just an idea. Maybe you guys got other ideas. Maybe this will launch into another better idea. That's what I'm hopeful for. That somebody might say, yeah, it's not a bad idea, but let's come up with something a little bit different in York that could help York County a little bit different, or something a little different in Polk County. So,
yeah, for this last minute that we have, please put in the chat or unmute. As Don had mentioned, what's a local resource that you find helpful for families?
And I would want to sing the praise of the Extension Office, the 4-H. I think you guys are doing great work in terms of promoting positive mental health literacy. So I will sing your praises high. Sometimes some of our resources don't realize or don't recognize the impact that you have because you're busy doing what you do. But I assure you that you're making a difference. Just like school counselors, the different levels of people engage with families, you're making a difference. We just need to be aware that promoting positive youth mental health literacy should be a goal. And as we talked very early in the presentation, it has an influence over how kids grow and develop. So once again, if you have any questions or comments, feel free to email me.
Rennie shared that 988 is a game changer.
Absolutely. It has been. And the data from 988, by the way, indicates that youth use of 988 has increased dramatically as they become aware of that resource. So that's been very useful.
And if we could quickly share our Four Corners website, Sarah put the link in the chat for our upcoming events. But then also, sorry, close your eyes for a moment, our mental wellness tab. This has many resources, this great grid you can print and share. You can also get access to our YouTube videos. So previous talks are on there. If you go up here, you can also get to our youth mental health resources. And we have media toolkits that are ready to go that have posters, social media posts. We'd like it if you could go to these and use them and then also share them. And then our recent youth mental health assessment reports, we'd sure appreciate you looking at those and sharing those as appropriate. And here's the connection to our webinars, previous webinars. Well, it is 1:02. Don, thank you immensely for your work today. I know you invested a lot to bring this talk to us today, how you brought everything together and kept it within 1 hour. That's amazing. So thank you. Thank you very much, Dr. Bilau and everyone else who joined in today. We'll stay live for a moment in case anyone wants to ask questions, but we'll go ahead and stop our recording and be available. Thank you, everyone. And please join us November 6th.
Thanks, Chris, and thank you all for attending. Appreciate it.